Let's see. PDF is okay. PPT is okay. And OSC is okay. So give me a second. I'll be teaching a lot of the topics which are called as ospe. They are topics which they'll ask in your practical exams of your college. So whenever there is a practical exams, these questions they'll ask. This has been technically been provided to me by my what do you call my college, but you can learn a little bit, I feel. So let's get started. We have, first of all, name the molecule this pill contains and the dosage. 1 second. So this is centchroman. Okay. It's also called antara, chaya, and this molecule name is centchroman, and the dosage you can see right here somewhere, maybe. No, in the image they have not provided the dosage. Then dosage schedule for this pill also you have to ask, and they ask for 3 adverse effects of this pill as a 3 marker and 3 contraindications of this pill. So this drug name is centchroman. It is 30 mg. Schedule is twice weekly you have to take for 12 weeks, followed by weekly once you have to take. 3 adverse effects you have: headache, nausea, vomiting, weight gain. Okay, there are 3 adverse effects. 3 contraindications for this pill: you have hepatic dysfunction, cervical dysplasia, and PCOD, polycystic ovarian disease. Those are contraindication. Then once again, headache, nausea, vomiting is very common, but weight gain is one extra you can add. Hepatic dysfunction, cervical dysplasia, PCOD. Then we have Mirena, which is a hormone releasing IUD. So hormone, I think it is progesterone. Let's see. Duration of the use 3 years it can be provided. Indication for this IUCD if they are done with the family and require family planning methods, if they do not want to take tablets, and if they there are a lot of contraindications, maybe something like cervical dysplasia if they want to have children, and maybe allergies. Let's see. So this is levonorgestrel intrauterine device, levonorgestrel, and it is duration is for 5 years. So indications of this IUCD in case of abnormal uterine bleeding, endometrial hyperplasia, and hormonal replacement therapy, you can provide them. Contraindication: if there is suspected malignancy, if there is uterine anomalies, and if it is a fibroid uterus, you cannot provide. Then we move on to antara, which is sterile aqueous suspension for deep intramuscular. It is a contraceptive injection. So this injection will contain steroid. So this is, I think, progesterone depot steroid. The frequency is probably for 3 months. Any 3 complications, you can have endometrial hyperplasia. Contraindication also malignancy, I think so. Let's see. So yeah, this is depot medroxyprogesterone acetate. It is progesterone. Frequency is 3 monthly. Yes. This thing, complications you will see: oligomenorrhea will be seen, menorrhagia will be seen, and breast tenderness will be there with weight gain and irregular bleeding. Oligomenorrhea, menorrhagia, breast tenderness, weight gain, and irregular bleeding. All of them can be seen. Then contraindications of this drug you cannot provide this drug in case of breast cancer because it will increase it. Unexplained vaginal bleeding, AUB, and suspected pregnancy and DVT also you cannot provide the antara contraceptive injection IM. Depot medroxyprogesterone, DMPA, you cannot provide this. and DVT also you can provide in cases of suspected pyruvate. It will cause oligomenorrhea, decreases the menorrhagia, and menorrhagia increases the bleeding or decreases the bleeding, and breast tenderness, weight gain, and irregular bleeding. Breast cancer, unexplained vaginal bleeding. Okay. Then Malayan is a what do you say? I think biphasic what do you say, contraceptive drug. Hormones in this pill is estrogen and progesterone. Then mode and method of administration: 28 pills, 21 pills are the drugs, and 7 pills are iron. Side effects: you'll have what do you say, nausea, vomiting, and stuff like that. Non-contraceptive use of this pill in case of cervical cancer, not cervical cancer, endometrial cancer or some stuff like that, endometrial hyperplasia and stuff like that. Wait, let's see. So ethinyl, estradiol, and progestin, they are the hormones in the pill. Then mode and method of administration: 5th day of menstrual cycle, continue for 21 days. Okay, from the 5th day you take for 21 days, then the last 7 days you have iron for replenishing the iron store. Side effects: again, breast tenderness, weight gain will be there, nausea will be there, headache will be there, mood swings, and vaginal dryness can be seen. Vaginal dryness is one important thing. Then non-contraceptive use in case of dysmenorrhea: if they are having very painful menstruation and if they do not want to menstruate, you can provide it and it will not lead to menstruation. Then menstrual cycle irregularities also, in order to reset it. Endometriosis is one exception. Endometrial ovulatory dysfunction, and to control menstrual blood loss and improve anemia, you take this. Then we have the procedure of episiotomy. Then the indication: if there is a restriction, like after coming off the head, there is a restriction. If mother cannot be is having heart problems or some stuff like that, and if she is having blood problems, then she cannot actually bear down for long, or prolonged labor is contraindicated, then you have an indication to do this procedure. The right time to do this procedure is after the visibility of the fetal skull. Any two complication, you have what do you say, vaginorectal fistula will be formed. That is one complication. And another complication, just surgical site infection. And what are the types of this procedure? You have J incision, medial, lateral, medial, and inferior. A lot of things are there. Let's see. This is medial lateral episiotomy. Medial and medial it's more, and lateral it is less. The angle you have to assume it somehow, but it's 45 degrees. I don't know, from medium to lateral you can somehow they named it like that. Okay, indications to do this procedure: in case of macrosomia, when the baby is very big; in case of breech, baby; and in case of instrumental delivery and shoulder dystocia, shoulder is getting blocked. Then it is done during crowning of the head, if the crowning of the head is occurring. And complete perineal tear can occur, bleeding can occur, vaginal hematoma can occur. And types you have lateral, mediolateral, and medial. Okay, medial is just downwards, mediolateral is 45 degree, and lateral I think is 90 degrees. Okay, then we have the photo of anencephaly. The risk factors of this condition are because of what do you say, folic acid deficiency first of all, and old age patient. How early can this condition be noticed? I think by growth scan using ultrasound we can notice that there is absence of the fetal vault in sometime around maybe like very early on, second or second trimester only, sometime you can do it. Drug prevent to this anomaly and dosage of the drug is folic acid 200 microgram per day for 1 month before the pregnancy consumption up to second trimester. So this is a fetus with anencephaly, pre-gestational diabetes, and inadequate folic acid intake, and genetical. Okay, diabetes, and folic acid and genetic. Yeah, in second trimester only 11 weeks by ultrasound you can find out. And folic acid, 5 mg 3 months prior to pregnancy. They say that, but some other things are there. This might not actually be correct, but let's see. Then we have this is postpartum hemorrhage, uterine manual compression, I think bimanual compression we call this. Then when do you do this manual? During postpartum hemorrhage. 4 alternative methods. You can do B-Lynch suturing, you can do uterine artery and ligation, and 2 medical methods and 2 surgical methods of this diagnosis. So 4 alternative methods. Okay, B-Lynch, you can do you can provide a balloon catheter, Foley's catheter inside. You can provide B-Lynch. You can do, then you can do how do you say, uterine artery ligation I told. And there are 3 types I told, and one more maybe uterine massage also you can do, but no, something else I'm missing out. There is also the square sutures. Maybe I'll just write the square sutures. Fine. Hysterectomy also you can just do off. Fine. 2 medical and 2 surgical method for this diagnosis. Medical methods of diagnosis. Surgical methods of this diagnosis, you can just look at it. Medical method, I don't know. Mode of action for this menu, providing direct compression to the uterus. So this is bimanual uterine compression, yes. Postpartum hemorrhage, yes. So in medical, you can provide oxytocin, carbetocin, you can provide methagen, misoprostol, all of them you can provide. Surgically, you can do bilateral uterine artery ligation, B-Lynch suture, internal artery ligation, and hysterectomy. Okay. By kinking of the uterine artery, so uterine artery will be kinked in this procedure, I say. Okay. Then we have NST, maybe. And tocolytic stress test, maybe. A and B graphs will indicate normal BP, yeah, normal heart rate, and down is normal uterus contraction, maybe. And components of this investigation. So this is biophysical assay. Biophysical assay is uterine movement, uterine tone, attempts at breath, NST, and this thing. No, wait, no. This is NST only, I think so. Acceleration, deceleration, basal tone, basal rate, and you have beat to beat variability. Minimal duration for this test to be performed 3, 4, 5 months. No, wait, 5 hours. 10 minutes. No, wait. 20 minutes, I think so. I'm not remembering. Yeah, 20 minutes. Okay. This is cardiotocography, not even NST. But yeah, the beat to beat variability, baseline fetal heart rate, acceleration, deceleration. That was correct. And fetal heart rate, and B is maternal uterine contraction. Correct. Okay. Heart rate, and this is the uterine contractions. Okay. 20 minutes you do. This is gestational trophocytic. What do you say? H-mole, hydrated mole. This is H-mole, and symptoms, there is passage of grapes like structure with vesicles, and abdominal pain maybe, and severe nausea, vomiting. Method of diagnosis and appearance, ultrasound is being done, and its appearance is that of grapevine appearance or vesicles, grape like vesicles appearance maybe. Complication, if it is untreated, you can have systemic shock and sepsis. You can have Drug used for chemotherapy of this condition, probably antibiotics. I'm not sure. Methotrexate maybe. Let's see. This is vesicular mole. Symptoms, you will have amenorrhea, bleeding per vaginum. Ultrasounds, no some appearance will be there. That is one characteristic. Then persistent trophoblastic disease or choriocarcinoma. It is a complication. There is persistent trophoblastic disease or choriocarcinoma. And methotrexate, obviously. Drugs used for chemotherapy, methotrexate. Then we have the partograph. We had a question on this and I really could not attempt this. I feel bad. I didn't know about the pulse contractions and stuff like that. What does the image show? Partogram. Name 3 components. General details. You can, let's see, fetal condition, progression of labor, and maternal condition. Then when is the uploading to be started? When immediately after being admitted. Name 3 advantages. It makes sure that the labor is going in a correct direction, and in cases of delay of labor, we can do appropriate interventions. Adequately measure the fetal health, stuff like that. Okay, so it is to be plotted from active labor from 4 centimeter of cervical dilatation. Okay, advantages: you can detect abnormal progress of labor, you can avoid late referrals from rural health centers, and it is of low cost too. You reduce cesarean section and reduce maternal perinatal mortality and morbidity. Okay, then we have gynecology. This is inversion of the uterus. This occurs in the 3rd stage of the labor. Risk factors is laxity of the muscles, severe prolonged labor, and increased age maybe. Name 3 symptoms. They are shock, one of the most common cause of shock, and what else can I say? Shock will be there, infections maybe, sepsis maybe, tachycardia, stuff like that, and severe pain. Let's see. Okay, this is uterine inversion, 3rd stage of labor. Uncontrolled contraction, adherent placenta, contraction without tocolytics. So 3 symptoms: pain, hemorrhage, and sudden collapse. Hemorrhagic or neurogenic shock. Sudden collapse, hemorrhage, and pain. And uncontrolled contraction, adherent placenta, and contraction without tocolytics. Okay, then we have the genitofemoral height. No, wait. Symphysiofundal height. My bad. This is the symphysiofundal height with gestational age and the measurement accurate, and it is up to 36 weeks. It is accurate. The condition when it is less than the period of gestation. Intrauterine growth restriction. Less than the period of gestation. The condition if this measurement is less than the period of gestation. Okay, intrauterine growth restriction. Polyoidomnous. No, oligoidomnous. Okay, leave it. I'm not getting the third one. Name 3 conditions if this measurement is more than the period of gestation. First of all, it is okay. Another thing was this thing. Polyoidomnous will be more, multiple pregnancy will be more, and something else I don't know. In this one, in the third one, where the measurement is less than the period of gestation, you can do it in 40 weeks of pregnancy. Okay. Incorrect gestational age, oligohydramnios, and intrauterine growth restriction. Here it is macrosomia, polyoidomnous, and myoma, complicating pregnancy. Okay. Measuring symphysiofundal height. 20 to 34 weeks of gestation. 36 also it is accurate. 36 is accurate. Then 40 it will come down. Then we have, okay, this is the forceps delivery. Three indications of this method in cases of fetal asphyxia, sudden distress, fetal distress, complicated pregnancy and stuff like that, and a breech presentation, yes, it is indicated by forceps, and to shorten the duration of labor, maybe in cases where it is contraindicated for the mother to be in stress. Three contraindications for this method may be no, I really cannot think of a single contraindication. Then, four prerequisites for this method: skilled obstetrician, first of all. Baby asphyxia is normal, maybe. Correct forceps, I'm not sure. Okay, this is outlet forceps in cases where there is fetal distress, cord prolapse, and maternal distress, VBAC, heart disease, mother. Then preterm, in cases where it is contraindicated, is preterm malpresentation, station is above the +2 with unrotated head. And for prerequisite, you should be having a fully dilated cervix, and there should be no central cephalopelvic disproportion. Sagittal suture should be there in the anterior, if the sagittal suture in the anterior posterior of pelvis, then it is it has to be. And if there is a empty bladder should also be empty. Okay, those are the four prerequisites: fully dilated cervix, no cephalopelvic disproportion, sagittal suture in anterior posterior of the pelvis, and empty bladder. Then we have this image of cervical circulate. So indication if there is recurrent pregnancy loss, if there is physiological weakness or hereditary weakness of cervical, and possibility of abortions. Indications, yeah, and when is the right time? Somewhere around 20 weeks of gestation. Contraindication, if patient is going in labor, something like that. In case of a dead baby, you do not do this. In ruptured membranes, you don't do. Let's see, cervical encirclage, it is indicated in cervical insufficiency prior multiple second trimester loss and cervical length less than 2.5 centimeter with dilated cervix. Then right time is somewhere between 11 and 14 weeks. And contraindication in cases of active preterm labor, chorioamnionitis, premature preterm rupture of membranes, fetal compromise, and fetal death. If there is fetal death, premature rupture of membranes, fetal compromise, chorioamnionitis, and active preterm labor, you cannot do circulation. 11 to 14 weeks you have to do, not 20 weeks. So cervical insufficiency, cervical length less than 2.5 centimeter, dilated cervix, prior multiple second trimester pregnancy loss. So this is an image of, what do you say? Conjoined twins. If it is diagnosed at term, delivery is by cesarean. Always it is cesarean. Diagnosed at the term of 20 weeks, what is the management? I mean, you can do abortion because it's less than 20 weeks after like going through the legal system. Three types of this condition: adherence at the head, adherence at the chest, adherence at the bottom. But in which type of, I don't know, monoamniotic, monoconiatic this is. So this is a conjoined twin. You do LSCS, medical termination of pregnancy, you do. Yeah, thoracophagus, which is this one, craniophagus, which is head, pyophagus, which is Ischiopagus is ischium. Pyrophagus, I'm not sure. Lovely stomach. So it is seen in monoamniotic monochorionic babies. Then you have PVA particles you provide. This is the, what do you say, catheter against the blood vessels you have to provide. Indications in cases of uterine fibroid, and which is to be managed, somewhat medically. Contraindication in cases of heart diseases, in cases of severe pain. It should, if you want the fibroid to decrease in size, then you do this. Okay. Uterine artery embolization, AUB, fibroid uterus, and secondary postpartum hemorrhage. AUB, fibroid uterus, secondary postpartum hemorrhage. Pelvic inflammatory diseases, you don't provide. Contrast allergy, if there is allergy to the material. Coagulational abnormality also, you do not provide this. And common side effects, you have infections will be there, bleeding will be there, thrombotic embolism will be there. Then we have this cervical spatula, and one should we start the screening for pap smear from the age of 18 years. Every 3 years you have to keep on doing until it is positive. If the test is positive, then you do HPV serum analysis first of all, then you do inspection under legal solution, computer management and all you have. Then grade 5 Papanicau classification. What is grade 5 Papanicau classification? Even I'm not sure actually. I think it's something regarding the materials in the missing blood. And one second, I remembered I had to do something. Give me a second. Okay, so actually give me a second. Okay, so we call it Ayer's spatula. It is done for taking pap smear, done in a sexually active woman more than 21 years of age. And further investigation, you can do colposcopy, cervical biopsy, you can do malignant cells. Grade 5 is malignant cells. And scarcospecialum, I don't know what is it. Unfortunately, I'm not sure how I can show you guys what the question is actually. Leave it. So this is an ectopic pregnancy, unruptured type. Risk factors in cases of uterine problem, pathology of the uterine cavity, in cases of IVF pregnancies, and in cases of presence of IUCD and or usage of IUCD also is a risk factor. It can be impacted in the ampulla, it can be impacted in the femoral end, it can be impacted in the abdomen. All the types of fallopian tube you have to write, all the types parts of cervix also you can write, maybe tubal, abdominal, ovarian, cervical, so tubal ectopic pregnancy, pelvic inflammatory disease, previous history of tubal surgery, congenital anomaly of fallopian tube, history of previous ectopic pregnancy, peritubal adhesions. Okay, so then sites of this condition, and what is this? Symptoms: amenorrhea will be there, pain will be there, adnexia mass will be there. Then this is Bartholin gland's cyst or abscess. Amusement is with incision and drainage. Bartholin gland, prevention of recurrence is removal of entire Bartholin gland. Good perineal hygiene and antibiotics. Sorry. Marsupialization. Bartholin abscess, you can do marsupialization. This is incision and drainage in the left, and in the right it is marsupialization, I think so. Then we have trichomonas, maybe Trichomonas vaginalis. Rosy appearance, I think so. B is rosy cervical appearance. A is yellowish discharge, white frothy discharge with bubbles. Frothy is bubbles. Name of the organism is Trichomonas vaginalis, maybe. Specific treatment is albendazole, nystatin, maybe. Profuse thin greenish discharge, strawberry cervix, Trichomonas vaginalis, and metronidazole, tablet metronidazole 7 days. Treat the male partner also, and good perineal hygiene you have to maintain. Then we have fibroid uterine myoma. Myomectomy is the name of the operation. Instrument used is myomectomy screw, and complications you have hemorrhage, severe pain, stuff like that. Prerequisites for this procedure: prior taking medical treatment, some stuff like that, I think so. They do put a Foley's catheter. It should be small, it should not be huge, and it should, like, in the structure of the uterus should be maintained even after removal. Let's see. Abdominal myomectomy, myoma screw, hemorrhage. Complications, you have hemorrhage and a lot of other things. Infections, rupture, torsions, just right. And hemoglobin level should be normal. Cause of infertility, other causes should be ruled out. Consent should be taken for hysterectomy and should be done in pre-ovulatory phase before the ovulation occurs. Okay. What is the diagnosis of this? This, I feel, is PCOD. Investigation to confirm. And what is the appearance scene is multiple cysts, ultrasound, and multiple cysts. Complications of this condition, you have complication and management. Complications, you'll have infertility, severe cyclical abdominal pain, maybe. Management, I don't know. Okay, this is polycystic ovarian disease. Ultrasound, necklace pattern you'll find. Complications, you'll have infertility, irregular mass, menorrhagia, and amenorrhea. You have infertility, you have irregular menstruation, you have menorrhagia, and you have amenorrhea. Menorrhagia, increased menstruation; amenorrhea, no menstruation, irregular menstruation, infertility. Management is first of all lifestyle modification. Weight loss will be there up to 10%. Oral contraceptive pills you can use. Metformin for the insulin and diabetes. Ovulation induction can be done if you want pregnancy. And that's all for obstetrics, OSPE. I'll come back and continue for other subjects in a while. For now, I'll stop the stream. Okay.